mynews.studio.
Over the last 20 years, emergency vaccination teams have moved quickly through both remote villages and crowded cities, stopping outbreaks before they spiraled out of control. But what happens when a shot in the arm is more than just a figure of speech?
And today's date is 2025-07-18. There's a new study out in the British Medical Journal that actually gives us numbers to match those stories. Since 2000, emergency vaccination campaigns have saved 300,000 lives across 49 low-income countries. That's not an estimate, that's historical data.
Exactly, and this isn't just limited to measles or polio. The research, which was led by Gavi and the Burnett Institute, tracked 210 different outbreaks: measles, cholera, yellow fever, meningitis, and even Ebola. The big question wasn't whether vaccines work, but just how much impact they have when things are at their worst.
And the numbers are striking. To break it down, across all these outbreaks, emergency vaccination campaigns reduced deaths by nearly 60%. For yellow fever, deaths dropped by 99%. Ebola deaths fell by 3/4. Even for measles, which spreads incredibly fast, deaths were cut by more than half.
These are diseases that, left to themselves, can devastate entire communities. Cholera and meningococcal meningitis, both often hitting places with fragile health systems, also saw large drops in deaths. But how do you actually get vaccines out quickly in areas with bad roads, mistrust, or even conflict?
That's where international partnerships become crucial. It wasn't just Gavi. Organizations like WHO, UNICEF, Médecins Sans Frontières, and the Red Cross all coordinated. They kept global vaccine stockpiles ready and supported things like mobile clinics and community health workers who would walk vaccines into hard-to-reach places.
But the logistics are only part of it. You also need to build trust. These teams worked with local leaders, used familiar messengers, and adapted their communication to local needs. In places where vaccine hesitancy could slow things down, that social side was often the deciding factor.
And it's not just about doing the right thing. There's an economic side as well. The study estimates $32 billion saved, since preventing deaths also means less spending on long-term care, fewer lost work years, and generally healthier communities.
But there's a caveat here. This isn't only looking back. The study also points out that during the COVID-19 pandemic, routine immunization slipped for diseases like measles and polio. Emergency campaigns are necessary, but they can't stand in for the foundation of regular, ongoing coverage.
So then, how do we keep the progress going? The researchers suggest that we need to combine what works in emergencies, quick response, local engagement, reliable supply chains, into our everyday immunization programs. If these strategies save lives during a crisis, why not use them all the time?
And it really comes down to partnerships. Gavi, governments, NGOs, they're sharing not just money, but also expertise and logistics. That's what keeps vaccine stockpiles ready, response teams prepared, and local health services strong.
This is basically a guide for future outbreaks. As Sonia Nishtar at Gavi said, for the first time, we can actually measure the payoff in both lives saved and dollars spent when vaccines get out quickly during a crisis.
So does this signal a shift in global health priorities? Or is it just a glimpse of what's possible if we keep moving forward?
That's the challenge ahead, but the evidence is there. Rapid, targeted vaccination saves lives, saves money, and helps communities stand stronger.
Emergency vaccination is about more than speed. It's about building trust, strong partnerships, and systems that can last.
Thanks for joining us as we dug into the data and the stories behind emergency vaccination campaigns.
300,000 lives, $32 billion saved, and a roadmap for the next outbreak. It's about partnership, logistics, and ultimately, people.
Thank you for listening. This episode was produced by mynews.studio. You can try it now for free.